2017 budget to understand how the logic which is built in the budget, in the draft budget, will work, presumably. So we will ask speakers to make their interventions, to describe their positions within 5 minutes, and then we will have discussion with the audience. So this will allow us to get a broad vision from the experts. So the first question is dealing with an important thing which is quite simple, but not clearly understandable from the budget. Whether we have sufficient budget, sufficient money allocated for reforming in the draft budget. And I would ask this question first to Mr. Sergiy Marchenko from the Ministry of Finance, then Mr. Sir Andriy Melnichuk from the Ministry of Health, and then our experts. So my answer will be very simple. We allocated some money, maybe not much, but something. We believe that as of today, under current conditions, the money allocated for the health care, they are not sufficient. The healthcare system experiences huge shortages because we invest money into the network of doctors, which is inefficient, and into the hospitals, which are inefficient. So we decided to set priorities. First, allocate money for people with serious diseases for medicines, and the second, and allocate some money for the local hospitals. At the same time, we believe that at current stage, local municipalities have to contribute some money to support, to maintain the local hospitals. For example, to pay for electricity in the hospitals. If local authorities believe that the hospital should be improved, upgraded, optimized in any way, they can do this because in the future, very soon, they will become the full-fledged owners of those institutions. As for the medical subventions from the budget, it will be enlarged, but not considerably. And the argument here is as follows. As soon as we see serious reforming steps aimed at the reforming of the healthcare system, we will immediately provide additional allocations for the local communities, for example, at the level of the region, at the level of oblast. As of this moment, we observe discussion in the ministry about future reforming, so there is no sense to allocate money at this very preliminary stage. So my question is now to Pavlo from the Ministry of Health, and What is your position? You asked the question whether there are any money in the budget for reforms. My answer is yes and no. Because the question should be put this way: what what is our overall goal? What we wish to do with those 46 billion of hryvnia allocated for healthcare system. Whether we wish to follow the way that we followed during many years, whether we wish to pay salaries to doctors, whether we have to maintain all the clinics, outpatient, inpatient clinics at the previous level. Unfortunately, the current level of all those facilities and salaries is so miserable that we should seriously think about reforming. And in current inefficient system, just increasing allocations for healthcare system is not a solution, because while doctors have salaries at the level 1,500 hryvnia, raising this wage up to 1,300 hryvnias won't resolve the problem. Thus, you double expenses without any significant results. So, the healthcare reform will become meaningful in our country when we will spend budget money on services for specific patients, and when we will be sure that this amount of money which are allocated, they will result in a delivery of some specific services to specific patients. While now requesting for money, we ask for money which most probably will be spent inefficiently. And here I support the Minister of Finance. I support Sergiy when he says that we should introduce incentives for the regions to own the local healthcare facilities, to own the reform of healthcare systems at the local level. Our next year budget has to speed up and to create incentives for reforming and not to deter it. Viktor Taran, an expert from Eidos Center. I agree with my colleagues in the part that allocated resources are spent inefficiently, that from the mid-1990s, the system, healthcare system, which we inherited, it had been being financed in line with the Soviet standard Soviet philosophy. We have to change the approach to the state budget. We should apply functional budgeting. As far as I know, the Ministry of Finance made an attempt to introduce this new paradigm, this new approach, but they did not have enough time this year. From the sphere of public in the sphere of public finance, we actually ask one question: how efficiently those money will be spent, and we are interested to see that the money which are allocated from the state budget, that they should be converted into efficient services. in the future, we will understand how this approach taken by the ministry as of today will be efficient. You mentioned the changes which you expect to happen this year or next year. Unfortunately, this year, the functional budgeting could not be implemented already because the draft budget is already submitted. This would be a radically different approach, and it may face a huge resistance from public, from bureaucrats, etc. But we cannot continue with the healthcare system as we used to do in the past. Oleksandr Yabchanka from RPR. We should understand how the reforming will take place. At the central level, we should establish general rules. Rules for treatment, like treatment protocols, and the routes, the procedures which should be followed by the patient, and about the functioning of the system, general principles for funding and management. The local level has to ensure compliance with those established rules. That is, to implement the local protocols of treatment and to support the functioning of the system. The local protocols deal with the preventions, with diagnostics, and with primary treatment of diseases at the primary level. In line with the treatment protocols which I mentioned, we should change the investment, approach to local investments into healthcare. Some purchases of new equipment and instruments should be carried out, and I do not see any allocations in this year budget for such procurements of equipment and instrument and tools.
I would like to comment. The funds for reform, no one cancelled such a notion as budget allocations, and if it is envisaged, if the funds are envisaged, then we can speak about it. And the question is, first, tell us please what was the logic to increase 20% the financing of institutions of medical sphere and resort institutions, and also decreasing the financing of the institutes that belong to the medical academy, named after Shalimov and others. And the question is, did the ministry consider the issues together with the ministry that the fund holders in these institutions, it should be not some sham scheme such as the academy, but directly the institutes should be the holders of these funds? Who is ready to answer? So the National Academy didn't get enough funds, and I have clear explanation why. And because they spend money mostly on salaries and civil servants, and we implement this law on civil service, and yes, there are some changes, but name these institutions, please. What institutions? I can't hear the question. He is speaking without microphone. Firstly, after this discussion, you can consider these issues and discuss them. Ministry of Finance, we plan. As to the Academy of Sciences, there is a problem, and they criticize us why we didn't provide funds for them. We analyzed the situation, and it shows that 90% there is a hospitalization that is charged about at the price about 5,000 hryvnias, and vulnerable categories of people cannot get this assistance. That's why, if this is hospitalization that is charged, what is the role of the state then, and what it is actually? All those interventions, these are the matters concerning the flagman of our state institutions. So this is less than 10%. Less than 10% of state support. We say change the status, make other organizational form, but you should work in other conditions. So they should be ready for market conditions. What we pay, what we buy, we don't even pay salaries there. So this decision can be changed by the parliament, because the pressure is tremendous. This is the most heavy influence, and we have clear position. Please propose the mechanism how to make changes. So if you would like to envisage some funds for treatment of people in these institutions, but this should be money for individual patients. So we are ready to provide all data. This is not official information, because all this free of charge medicine. So any person can go to this institution and ask what is the cost of treatment there. The only thing I want to say about the Academy of Sciences, of course, there is pressure, and this is a problematic issue. It's not black or white. And the Ministry of Health support the idea that these institutions should become independent. And they want this, and they have proposals, and we had the meeting, and the Ministry of Health want to provide autonomy, and we should transfer to this autonomy, and they are ready for this. These specialized institutions are now ready for this. So the next question I would like to ask about the possibilities to bring money to the regions, and we spoke about it, about the financing of reforms. So we are watched by many people. We work with regional media. Sergiy, you mentioned that successful communities will be able to get more opportunities and funding. So the question to each of you about decentralization, what should be done by local community or local regional oblast, how it works, in order that their community was successful and get the opportunity and funding for reforms. So what should be done locally? 3 minutes each. So there is a process of unification of territorial communities, and it is difficult. And those communities that united, they had benefits from this. These are not only funds that they got additionally, but also the opportunity to get subvention from the state budget for their support. And this year it's about 1 billion hryvnias. And as to decentralization of medicine, so I would like to tell the idea I said before. Local government should understand their role in these processes. They should become the holders of these measures, and this is an axiom. They shouldn't say that these institutions belong to the ministry or to academy. These are facilities, belong to local government, and they should understand that they can be effective owners of these institutions, and the role of state is to provide transformation of the funds we gather as taxes for buying some assets. So this is decentralization. We differentiate the responsibilities, and in this case we won't have any other issues. So Pavlo Kovtoniuk, so this is correct. The reform in the healthcare sphere should do one important thing, and we will do it, to clearly establish normal civilized responsibilities of government and local communities that exist around the world. So these roles are like this: national government that collects taxes from all the citizens. They should provide medical services. There is state guarantee in any part of country. A citizen should have the right to the same volume of medical service. Where can he get the services? He can be provided locally in the local institutions of healthcare. These are community institutions, private institutions, and the majority of medical institution belongs to regions, cities, and the role of these communities, it should be like this, that these facilities should be kept in a proper way, and there should be qualified doctors, and these institutions should function, and the person should be able to get there, and the state should buy this guaranteed volume of provision of this medical help. And you discuss it with the Ministry of Finance, yes, with the Prime Minister. So what would you advise for the start? For example, my region want to be leading, so they should invest. They shouldn't think about, look, local government should not think how this doctor treats patients there. This is not their concern. They are responsible about communal services, where the facilities are held properly, the road to the institution. So this local government understand these issues, and they should deal with it, and they should put their funds into it. The state should take care of medical sphere, buying some guaranteed package of medical help. Viktor Taran. They envisage in the budget enough funds, but it is stimulating in its character. Unified communities, they get for their so they get funds, but these funds decrease, and that will stimulate them for saving. So these funds that will be directed, it's not only for healthcare, but also for education and other important spheres. And this money should be used properly and effectively, efficiently, and they should be invested in infrastructure, in energy-saving technologies. And now, summing up, the funds are there, but they should be used properly. Thank you, Oleksandr Yabchanka. So I would like to briefly outline the problem, the key problem, and how we should work. Now the state promises everything for free in communal institutions. The medical help is provided free of charge, and they put it on shoulders of doctors. At that, the citizen do not have guarantees. The citizens have only promises. And Pavlo told us how it should work. The state should declare the guaranteed package of medical services, and this package the state should buy from the providers of medical help, and as it is shown on the slide, how it should really work. Money goes after the patient. So the patient chooses the doctor, and he is his partner. So he is his doctor who should prevent disease. And if you fell ill, so he should say what you should do. And in the framework of his protocol, he treats what he can and what he cannot. He direct and refer the patient where he can get this help. And in first case, when the patient chooses with whom he signs the contract, money goes with the patient, and then he can refer for a diagnosis or medical help, and money goes after him in the institution where he addressed to. And the institutions, they are in the ownership of the community. That's why the communities are interested in that these citizens address their institution, and here we will have competition in secondary medical assistance. So as to financing, it is understandable that the communities will be interested in that these institutions compete among themselves, and the citizens of this territory can address for diagnosis or other or treatment to other regions. That's why money can go to adjacent oblast or town. So in order to start this mechanism, we should clearly understand locally what should be done by local government. So to autonomize the institutions to buy and to develop local route of the patient, and to establish single network automated system how to control budget funds. So this should be clear steps. Local government can do it, and in this way they can get additional financing from the Ministry of Finance, and if you go along this way, it will work. So now we come up to the third question. This is an announced story that money goes after the patient, that you told us that there can be competition in the area. So how it is possible in the framework of those in the situation, because we know that a person was so is it really implemented in the budget of 2017?
You made right remark, because every day when I enter my office, I think that what you actually describe about which you actually described, that it's quite easy to be persecuted for any sort of violation, because the responsibility for budget money is huge. But depending on your tolerance to risks, you make decisions finally in line with your scope of responsibilities. You know, the responsibility usually limits our intention to act because it's better not to do things than to bear responsibility in case you exaggerate your scope of responsibilities. So sometimes when the mechanisms and tools for implementation of your important reforming steps, they are doubtful from the limiting legislation point of view, but you should think carefully. Maybe you should make first step and then seek for the changing legislation. If you would try to preserve the sacred cow for eternal period of time, then there will be no reforming at all. Having spent 4 months in the Ministry of Finance as of today, I realize that we are ready to undertake radical reforming, and we have reached understanding with the Ministry of Health, and we are ready to produce joint initiatives. Pavlo, how do you think whether it's possible to implement? I think that it's possible, and this can become a reality. We have got support from the Prime Minister in our idea that from the next year the money would follow the patients, and this principle we plan to introduce fully the next year. Even this year we will partially implement this principle via financial support to those hospitals, outpatient hospitals, where the numbers of patients are bigger than in neighboring hospitals. So this year we will carry out all preparatory work. All the hospitals will need to carry out the preparatory work, and actually we will gradually prepare everything to the new approach that the state money would follow the patients, and this will strengthen competition among hospitals. They will need, and among clinics, they will need to think how to attract the patients. Just one comment: how to control that they have real patients, but not just dead souls. We know how to do this, and I do not wish to describe this now in detail, but in general I may comment that only one single electronic space, electronic databases of the patients would be able to resolve this problem, and only this will allow us to monitor the situation. Viktor Taran, we are discussing whether we should expect that this approach will work. I am a bit skeptical about this process. I would like to know in more detail how you would assess the efficiency of the system as a whole. Today we raised the issue about dead souls, so to say. How you would monitor or trace back those people who attend outpatient clinics, not in their local village, town, city, but or region, but in neighboring city or town. Actually, you should, I suggest that you should think carefully about KPI and you should think carefully about the standard that you would set for medical institutions. Maybe you will assess the general health level, the level of diseases in the area, or what else. And when you will try to apply the program funding, only having applied this program funding in the budget, I think you will be able to apply the logic which you described up to the very end. Besides that, I think that without KPI, without clear standards, and about priorities for budget allocations, taking into account the scarce resources, Oleksandr Yabchanka and then the Ministry of Health will comment. First of all, about the possibility to implement this, about the level of realism. We cannot follow the way that we had been followed within 25 years. We have to either to make the capital overhaul of the system, or it will stop some moment. About skepticism, what could be the risks? That this topic might be over politicized, and I think that this threat may appear unless the tiny balance of political understanding between the parliamentary committee and the ministry is slightly disbalanced. And the second are the inherent risks in the system itself. But the key to success of this reforming is communication with the broad public. Each person, each citizen of Ukraine should be able to understand what's going on and what and how will be changed. The special audience, the special target audience should be medical workers. These are those who will implement this very reforming, and of course Ukrainian politicum, which has to understand that the reputational risks which might arise in case of non-implementing reform are much higher than the risks of implementing reform. And so this communication should be delivered from the executive branch. And now comment from Mr. Pavlo. I had a comment about moderate skepticism. I've already understood that in Ukraine people have a very strong desire to find hidden problems in each initiative. When you try to undertake any reform, the Ukrainians immediately try to invent hidden risks. When you say about dead souls, you simply do not know how many dead souls we have today. When Poland had launched this principle that money follows the patient, saved on half of the budget, they discovered that their population doubled because people were registered twice with different doctors. But this should not prevent us from reforming. So actually the problem exists. That is what you wish to say. Yes, that is what I wish to say, and that this should not prevent us from taking action. Further questions?
Первинного лікаря, так і закладу. Тобто це вже є в законодавстві. Постанова 12.
Resolution from 2012 establishes this principle, sets that money follows the patient. Actually, the legislation is ready. What you are going to do? We reviewed that legislation and reviewed the experience of pilot regions which tried to apply that legislation. And we understood that the problem with the second pillar of the reform, that is financial motivation to the doctors, it was not implemented. We analyzed the mistakes and shortcomings, but the idea is that we analyzed and we have ideas to how to apply it. And the final question for today's discussion. Maybe you will be able to set necessary emphasis. So how can you guarantee that the amount of money allocated for health care actually last year data says that people paid another state budget for their medical services. So how can you guarantee that money allocated from the budget, they are efficient? The question about efficiency is like the question about student stipends. How efficiently they are paid. They are efficiently paid because all the students got stipends, but whether it helped those students, actually this year we allocate money for all the hospitals and actually raised salaries by 20%, and from this point of view we have 100% efficiency and everybody looks happy, the patient, the state, the doctors, but I'm a bit skeptical. We have 46 billion hryvnia. We understand how we get them, but the issue is how we spend them. When we pay to the doctors, when we pay to the hospitals, we do not know how many people get this medical services, how much do they pay additionally for those services, and that's why, from this point of view, the healthcare system is absolutely inefficient. In line with the legislation, it looks like allocated money will reach the doctors and hospital premises will be heated, warmed, etc. But from medical point of view, the state would not deliver necessary services. So the money is allocated, but what we will get for that money, we do not know. Pavlo, what could you add about effectiveness of money spending? I understand efficiency from the following point of view: how much we are satisfied for the allocated money. In the past, the approach was as follows. When the objective was to provide money for everything, then we should be happy. We provided money for the system, while we should change the emphasis. We should pay to those doctors which deliver medical services to patients, real medical services, and we will ask whether money reached really those doctors who were chosen by the patients, and whether working conditions of those doctors improved. We will measure this. We will understand whether the money were used efficiently. Next year, I can responsibly say that I will be able to measure efficiency. When we look at the efficiency, we try to understand whether those money which are allocated from the state budget, whether they reach final patient, and what are indicators of this efficiency. As of today, allocated money at the level of 20% are dissolved or used not in line with the purpose for which they were allocated, and actually this damages the health of the nation. And if we wish to change the system, the ministry should apply the audit So the ministry has to undertake audit of their healthcare institutions which are under the Ministry of Health, under the Ministry of Defense, that sanatoria, that hospitals, and cut down the necessary resources. And the second is to apply program funding and develop efficiency indicators, KPI. This year we did not manage, and what we should do for the next year. I will describe the ideal system. In the world, we have treatment protocols and the system of
має бути взята на
Як на
озброєння.
СТО.
Прошу? Як на
Як на СТО.
Окей. Дуже просто провести таку, тобто для
and this is referral system, how the rules which the patients have to follow in their healthcare area. So we should follow and apply the European technologies in healthcare. Each participant of the system should be registered in single electronic system. And actually, every citizen is registered in the electronic system. And the protocol, the treatment protocol, exists an electronic system, and actually each diagnostic step, each treatment step in terms of the specific patient is registered, monitored by the system, and each such step it values it has its cost, and thus state money are paid for each person. They are paid for something which was really done to this very person. This is how it works in the world. This was the last question. If there are any questions from the audience, let us try. Yeah. We have described the picture in line with which many people in the regions have to work.
Yeah, it's Maria, UCMC. I have a question to Pavlo and Oleksandr. When we can expect this protocol be the part of our daily life, and what country do you choose as an example? So first question, when? I have a simple goal, 2017, first medical assistance and primary medical assistance, and then we have a deputy minister that deals with this area. But as I know, the science is overall for everyone in the world, so everything is based on practice. So in different countries, these protocols are written differently, but it doesn't mean that there are different protocols in different states. And how we are going to write them, this is our goal for now. So thank you. I wanted to say this. First, we have adopted protocols, the part that is important to start this preliminary stage. Maybe we should ask Deputy Minister about that. But I believe it is so. And what I want to advise, not to wait until we adopt through bureaucratic procedure 100% of the protocols. Firstly, protocols are constantly renewed and updated, and Great Britain, the United States, they develop protocols. All other states just adapt them to their national legislation, and locally, these protocols that are adopted at the national level, they develop local protocols. So this is like instruction how to implement protocols locally, because there's one story when this protocol is implemented in the capital of the state, and for example, one institution is enough for this, and for example, in the village, this would require referral of the patient from one institution to another. So this is logic. In order to start protocol for provision of first medical aid, then this should be started in 2017. Thank you, dear speakers. Thank you. This is the end of press briefing. Goodbye.